You should be very vigilant while you are applying for the data flow, especially for your employment certificate. Your salary should be in your bank account. Will come to a blacklisted hospital. Regarding the license and experience, what is the relation? So how many years my DHA eligibility letter will be valid or my MOH evaluation letter will be valid? Welcome to Nursing MANTHRA. I hope all you are keeping well. Stay safe from COVID. What all things you have to consider? So we are discussing regarding that. First important thing, wherever the hospital you are going, you should make sure that your salary should be in your bank account. Those who are giving the salary in your hand, it is not good for your data flow verification. Because you don't know, your hospital maybe after like a few years, maybe it is a blacklisted hospital, or maybe the hospital will close due to the financial crisis or some other reason. In that case, if you want to do the data flow verification, usually they will ask for your salary statement in your bank account and PF statement also. End of service details, PF statement, bank statement, all these details are asking. In some cases, you worked in a small hospital and it was a good hospital. There was no fake certificates and all giving, and there was no blacklisted hospitals and all. But maybe after a few years, there is a chance that this hospital will come to a blacklisted hospital during the verification by the data flow team. In that case, if you really worked there also, your data flow report comes negative. I got so many customers, those who got the negative verification report, but the candidates actually they really worked in that hospital. How it is happening means, when they are doing the license renewal in Gulf countries, automatically the authority will send for a re-verification without the knowledge of the candidate. So what will happen means, in the data flow, their database, if that hospital is blacklisted, next your certificate also will come as a negative report, it will come. So you can't continue in that authority anymore. This is happening. So many applicants are back of this incidents. So make sure that for a newcomer who is joining to a hospital after your nursing course or any course, any allied health professionals, all the professionals, you should make sure that your salary should be credited to your bank account, so that you have a proof that you worked in that hospital for the 2 years. And as you all know that the minimum experience it is required for your applying for the authority licensing, that is 2-year experience. This 2-year experience, it should be after your registration. Registration means after your license. The nursing council registration after the that issue date of your registration. From that date, 2-year experience is mandatory. Now we can see that only for the DHA there are some excuses that they will consider from your degree issue date. If you are like registering late also, they will consider it after your degree issue date. 2-year experience they are considering, but we don't know, maybe in the future they also will change the rule. For the Department of Health, Saudi or Ministry, Oman, Qatar, everywhere, after your registration, 2-year experience is mandatory. This also be like very important in your experience, regarding your experience certificate. And when I am doing a data flow for a customer, I have noticed that there is the dates are same for 2 hospital, the end date and the starting date for 2 days. That means one hospital she is having the experience until 31st August, but another hospital, the new hospital, she joined on 28th August, she joined in another hospital. Like that one incident is there. So the hospital, how it is happened means, she after resigning, she got her off PF, everything, off leaves, everything she has taken. So this 3 days before she like relieved from the hospital. But in the experience certificate, as per her contract, they have mentioned 31 August. Then in another hospital, suddenly she joined to the nearest hospital and they have mentioned the same joining date in that hospital. So now in the data flow, they are asking how you can work for 2 hospitals at the same time. So these are the small mistake it is happening. I have noticed while doing the data flow verification of few candidates. So make sure that after completion of one hospital, the dates, then only you can join, give a 1 week gap, then join in another hospital. Then regarding the license and experience, what is the relation? Make sure that you should have same state license for your experience. That means if you are working in the state, that Karnataka state, you should have Karnataka Nursing Council license should be there during the same experience period. And most of the authorities asking the same thing. Okay, only for DHA we have some excuses that with any one license, okay, we can do it like that, in especially in India, like that. If you worked in Saudi, then you have to submit a Saudi license. If you worked in India, like that. For the DHA also, the rules are changing nowadays. So make sure that the license should be from the same state. If you worked in Kerala, it should be from Kerala Nursing Council registration. After that registration, you should have complete 2-year experience. I hope you understood regarding the license. Not only for the nursing, all the professionals, even allied health professionals also, doctors also, where you are working in the same state, registration should be there. After that registration, 2-year experience should be there. I have noticed that in the Ministry of Health UAE, they rejected the application after finishing everything. They rejected the application only because of this issue. They are saying that there is 1 month gap of experience after the registration, because before the registration itself, the candidate joined in the hospital and got the experience certificate for 2 years and applied, but finally the license will be like after 1 month of joining the hospital. So what happened means 1 month less after the registration in the same state. Even the candidate have other state registration that they are not accepting also. I hope you cleared with this license and experience issue. And in some cases, I have noticed I got some queries regarding 100-bedded hospital is mandatory for data flow application or not, like that. Because some of the agency told them that the clinic experience is not valid in UAE, you should make a fake certificate in the hospital, like that. Some of the applicants are saying like that, and they made fake certificate, later on it came native, and also many issues are happening like that. So there is not mandatory that 100-bedded hospital is required. Even clinic experience also they are calculating. But your role should be staff nurse or a registered nurse. What is your role? Or dental assistant, what role? That should be there mentioned in the certificate. And the department, which department you are mentioning, that department also should be there in the hospital. That also very important. And you should make sure that 2-year experience should be complete 2 year. We have faced an issue while applying an application, only gap of 2 days. They rejected the application. There is 2 days gap for completing the experience for 2 years. That's why rejected the application. So make sure that you are complete 2 years. Always better to ahead 1 week you can continue. That will be better. Then when you are getting the experience certificate, make sure that you are getting the same title role in the job place. That means some of the hospitals, if you are a fresher, they will write like trainee nurse, and for 6 months they will mention trainee nurse, and remaining 1.5 years they will mention like staff nurse. So that they will not consider complete 2 year as a staff nurse there. So they will consider only the staff nurse join date to the end date. So only 1.5 year experience only you will be having. This trainee nurse, if they are mentioning it, will not be calculated. So make sure that if you are getting an experience certificate, your employer should mention like you worked as a staff nurse or registered nurse for complete 2 years. Better to write registered nurse for 2 years. Okay, so if they are mentioning trainee nurse, when you are joining itself, they will inform you that trainee nursing will be there for 6 months. If they are mentioning like that, then you have to work for 2.5 years. If you want to work in abroad, especially in GCC countries, so make sure that you are getting the same title role, but you need registered nurse for 2 years, starting date and ending date. That also should be after your license registration date. Then not only for the nursing, if you are an anesthesia technician or OT technician, CCD technician or dental assistant, what category you are applying, the same title should be there in your experience. So if you are applying for a dental assistant category, the experience certificate should mention as dental assistant. You worked as a dental assistant. Even dental nurse also they are accepting, but they will ask for job description also. And regarding experience certificate, it is always better to get a job description also with your experience certificate if your employer is providing. In future it will help. In some of the specialty fields, what all the like, especially for the surgeons, then the specialization degree, those who are having, they can get a job description also with this experience certificate. And for the doctors and all, surgeons and all, logbook and all, you can keep all the surgery details, all those things you can keep with this experience certificate, plus job descriptions also. And when I am getting the application for the data flow, I have noticed that most of the allied health professionals, they are not doing the registration. Without doing the registration, they are starting to work. and they will be having 2-year experience. When they are trying to go abroad, then only they are doing the registration. So this process is not good and it will not be valid also. They are asking after your registration you should have 2-year experience. Now only for the DHA they are having some consideration is that maybe after a few months they will change the rule also. But for the HAAD, MOH and other authorities also, they are asking after registration 2 year. So all the allied health professionals, you should do the licensing registration. After that only you can start to work. That will be better option for you. Then regarding the allied health professionals in the license registration, there are some issues are going on. Regarding that I will make a separate video so that you will understand for your registration details. Then regarding the experience, so many applicants are asking a query regarding I have done the data flow verification until 2019 October. My experience certificate has done like that, already done data flow verification. So how many years my DHA eligibility letter will be valid or my MOH evaluation letter will be valid? You should make sure that if you get the DHA eligibility letter or MOH evaluation letter or any authority evaluation letter, if you are getting also, you should make sure that there is no 2-year gap with you, experience gap. Before reaching 2-year experience gap, you should enter in a job. So it is always better at least before 1.5 year experience gap before starting itself, you have to start the process and complete the process. Don't start the process just 1 month before your 2-year completion, gap completion, because the problem means the employer will not get enough time to activate your license. So you should give proper time for your employer to activate your license. Always better to start your data flow if you have experience gap, 1.5 year gap between this gap. Even we are saying that a 2-year experience gap is acceptable, start the process 1.5 year after itself. I hope I have completed some of the issues which I faced, and I have got so many queries also regarding the experience. So if you have any queries regarding the experience certificates, then please mention in comments. And one more important thing I want to tell, don't make fake certificate. At any cost, don't make fake certificate. I have noticed that so many fake certificates, initially the data flow result came positive. But after 4 years, without knowing the candidates, without knowing by the candidate, this data flow, the authorities are sending for re-verification and it will come negative also. So don't try to make a fake certificate. Get 2-year experience, then only apply for the job abroad. I hope you understood regarding the issues in experience certificate with the data flow. If you have any more concerns or issues or any suggestions, you can enter in the comments of this video. Thank you.
Nursing Manthra website provides you information about nursing news related to licensing procedures to different countries. Study materials for different exams like DHA, HAAD, MOH and other prometric exams. Various job informations in the medical field. Free PPT presentations and notes for the nursing students as well as the lectures. Data flow and licensing verification services to all countries. Free crash course videos for different nursing exams in Nursing Manthra YouTube channel. Current news in the nursing field. I am inviting everyone to the Nursing Manthra family. Please subscribe and join Nursing Manthra to avail more updates. Thank you.